Today, we are going to look at development of the head and neck structures. In this lecture of development of head and neck structures, a very long lecture, so I don't routinely do it in one sitting. Instead, I like doing this lecture in usually 4 parts. And today we'll focus on the first part only. That first part of development of head and neck region, we look at what we call pharyngeal apparatus, and we also look at the derivatives of the pharyngeal apparatus. And that's what you're going to do today. But in the second part, I usually look at development of the endocrine glands of the head and neck region. And in particular, we focus on the pituitary gland, the thyroid gland, and the parathyroid gland. We look at how they develop and their malformations, basically. Then in the third part, we look at development of the face, the tongue, and the palate. And I like looking at this together because somewhat their development is also closely related, especially the one of the palate and the one of the face. Then lastly, usually look at development of the eye as well as development of the ear. Those may also be a bit long, but I prefer combining them so that we don't really split so much. So as I've told you, today we are only looking at section 1 of development of head and neck, and that is going to focus on the pharyngeal apparatus. When we talk of pharyngeal apparatus, we are referring to some structures which are called pharyngeal arches, pharyngeal clefts, pharyngeal pouches, pharyngeal membranes. And we are also interested in the derivatives of these structures. So in this lecture, we are going to define what are these pharyngeal arches, what are these clefts, what are these pouches, and what do they become? Let's start by stating the components of pharyngeal apparatus. Pharyngeal apparatus consists of what we call pharyngeal arches, consist of what we call pharyngeal pouches, consist of what we call pharyngeal clefts, and consist of what we call pharyngeal membranes. I'll be showing you these structures shortly so that you'll figure out, so what is the membrane, what is the pouch, what is a cleft, and what is the arch. But basically these 4 are the components of pharyngeal apparatus. So when you talk of pharyngeal apparatus, we're referring to these 4 structures. So perhaps this will be a deal breaker. During embryonic development, mesenchyme grows around the primitive pharynx of the embryo. And the mesenchymal growth around the primitive pharynx of the embryo exist in form of paired bars. So as mesenchyme grows around the primitive pharynx of the embryo, this growth of mesenchyme extends in form of some paired bars. And these paired bars of mesenchymal tissue around the primitive pharynx is what we call the pharyngeal arch. So a pharyngeal arch is a paired bar of mesenchymal tissue around the primitive pharynx. This growth occurs largely around the 4th week of embryonic development when neurocrest cells migrate into the head and neck region, which means that this mesenchyme is partly of neurocrest origin, in as much as this mesenchyme is also from mesoderm origin. And so the statement I'm making at this point is that the mesenchyme of the head and neck region can either be of neurocrest origin or can also be from the intraembryonic mesoderm. Remember, mesenchyme is basically embryonic connective tissue. So as mesenchyme grows in the head and neck region, the developing head and neck of the baby, it will exist in form of some paired bars. And those are the ones you're calling pharyngeal arches. These bars usually resemble the gills of fish, if you've seen one. And those gills of fish are the ones we call branchia. For this reason, the pharyngeal arches are also known as the branchial arches. Now remember, there's an N somewhere there, so don't call it brachial. It is branchial arches. It is easier for you to call it pharyngeal arches. But basically they resemble the gills of fish. At some point during embryonic development, the head and neck of the human embryo resemble the gills of fish. Having said so, usually the first 4 pairs of arches are the ones which are definitely visible. And these first 4 pairs of arches are simply called the first arch, the second arch, the third arch, and the fourth pharyngeal arch. Remember that these arches are basically cores of mesenchymal tissue. And remember that they are paired. So there are those that are on the right and there are those that are on the left. Only the first 4 are definitely visible, as we can see in this image. The 5th and the 6th arches are not visible well. And so that is also in a way to tell you that actually we have a total of 6 arches or 6 pairs of arches. The first 4 are well visible. The last 2 are not well visible. Now, even though there are a total of 6 arches, in humans, something unique happens. In human beings, the 5th pair of pharyngeal arches disappear. It involutes. And that means that, therefore, in humans, there are a total of 5 pharyngeal arches. But in terms of how we name them, we will call them the first arch, the second arch, the third arch, the fourth arch, and the 6th arch. We don't talk of the 5th arch, even though there are 5. Reason being that the 5th pharyngeal arch disappears in humans. Okay, so having mentioned the concept of the pharyngeal arches and that we have a total of 5 of them in humans, but the naming system is as I've told you. Now I can clarify on a number of things that constitute the pharyngeal apparatus. Look at this image. Let's assume that this is the inside of the pharynx. Remember, it is on the internal side, so we will expect it to be lined by endoderm. Then consider this out one to be on the outside, so we'll expect that to be lined by ectoderm. And this tissue between endoderm and ectoderm is what we call mesoderm. So this is the cavity of the pharynx. So we would consider this to be the wall of the pharynx, right and left wall, but internally lined by endoderm and externally lined by ectoderm. In between, you have mesoderm. When neurocrest cells migrate into the developing head and neck region, we will have the arches now forming. And so the image below shows us the arches which are forming, or rather the arches which have already formed. They are condensations in form of bars, but the image you are looking at is a cross-section, a coronal section of the embryonic pharynx. And so inside here will still be the cavity of the pharynx, and outside will be the external part. And so this is the wall of the pharynx on one side and the wall on the other side. The swellings we see are therefore the pharyngeal arches, which have been cut in cross-section. They've been cut transversely. So that will be the first arch, that's the second arch, that's the third arch, that's the fourth arch, and this is the sixth arch. We've agreed that we don't have the fifth pharyngeal arch in humans. Having understood that, therefore, we can see that between one arch and another one, there's some narrowing. So those narrowings have different names, and I want to now clarify the names. Between one arch and another one, on the inside, which is lined by endoderm, that depression on the inside is what we call a pharyngeal pouch. So a pharyngeal pouch is what separates a pharyngeal arch internally. The depression that separates one arch and another is called a pharyngeal pouch. And similarly, the depression that separates one arch and the next one externally is called a pharyngeal cleft. Some people call them pharyngeal grooves. So a pharyngeal cleft or a pharyngeal groove is lined by ectoderm because it is from the outside. A pharyngeal pouch is lined by endoderm because from the inside. Importantly also to note in this image is that between one arch and another one, yes, that region of narrowing, remember the pouch is the depression on the inside. The cleft is a depression on the outside. What about the tissue interface between the two arches? The tissue interface between one arch and another one, which is this one here, is what we call a pharyngeal membrane. So a pharyngeal membrane is a tissue interface between one pharyngeal arch and the next. And I want you to take note that because it's the tissue interface, a pharyngeal membrane actually consists of all the three layers of the trilaminar embryo. It has the ectoderm, it has the intraembryonic mesoderm, and it has the endoderm. A pharyngeal membrane consists of all the three layers of the gastrula. All right, so that I hope explains to you, therefore, what we mean by the pharyngeal apparatus and their components. Importantly, it explains to you what an arch is, what a cleft is, what a pouch is, and what a membrane is. Having done so, I want us to now narrow down to each of the four components of the pharyngeal apparatus. And I want us to start with the pharyngeal arch. I want us to talk about what is it that is actually within this pharyngeal arch. Each pharyngeal arch consists of a core of mesenchymal tissue. And I've told you that this mesenchymal tissue has dual embryonic sources. The mesenchyme within the core of a pharyngeal arch can either have come from the intraembryonic mesoderm, but this mesenchyme also may have come from neurocrest cells. So this core of mesenchyme has those dual sources, neurocrest cells as well as intraembryonic mesoderm. This core of mesenchyme is lined externally by ectodermal layer and internally by the endodermal layer. So this is the arch, but internally it is lined by endoderm. So that means that the cavity of the pharynx on this side, and externally it is lined by ectoderm, which means this is the side of the surface of the body. Within the core of mesenchyme, there's a time that a cartilage bar develops. And so a pharyngeal arch consists of a cartilaginous bar within it. We would expect cartilage to develop within that core of mesenchyme. Apart from cartilaginous bar, and primarily the cartilaginous bar offers structural support to the components of the pharyngeal arch. That's the primary role, to provide structural support. Then we have a blood vessel that runs within a pharyngeal arch. The blood vessel that runs within a pharyngeal arch are basically branches of the aorta. At this time, there's a large artery that comes from the heart, which we call the aorta. And this aorta gives some paired branches on the right and on the left, that is, which cross through the pharyngeal arch. And so we call them aortic arch arteries. Each pharyngeal arch has an artery within it, which we call an aortic arch artery. You can call them pharyngeal arch arteries. The purpose of this blood vessel is to supply the different components of a pharyngeal arch. Within a pharyngeal arch, we also have a branch of a cranial nerve. And basically, this nerve supplies the musculature of a pharyngeal arch. And that means, therefore, that a pharyngeal arch also has some muscular components. The mesenchyme of the pharyngeal arch will give rise to some musculature, what we call muscles of pharyngeal arch origin. And so the cranial nerve basically supplies the muscular components of the pharyngeal arch. But that's not the only role of the cranial nerve. The cranial nerve will also supply the mucosa. That means that the epithelial lining on this side, on the internal side, the mucosa that lines the pharyngeal arch will also be innervated by that particular cranial nerve, as we can see even in this image. So those are the components of a pharyngeal arch. These images show us what I've just told you. So at some point, there's a large vessel that comes from the heart. We call it the aortic sac. This aortic sac gives branches, paired ones, so we have right and left, which go through the pharyngeal arches. So each pharyngeal arch will have a blood vessel running through it. And so you'll expect the first aortic arc artery, the second aortic arc artery, the third, the fourth, and the sixth aortic arch arteries. These aortic arch arteries, they arise from the aortic sac in front, and they terminate into another primitive vessel behind, which we call the primitive, or rather the dorsal aorta. When we discuss development of the cardiovascular system, you'll then understand what's an aortic sac, what are these aortic arch arteries, and what is this dorsal aorta. To your right shows you the different cranial nerves which give branches that enter the pharyngeal arc. So we can see the fifth cranial nerve there, the seventh cranial nerve there, the ninth cranial nerve, and the 10th cranial nerve. These are the cranial nerves which give branches that enter and supply the different muscular components of a pharyngeal arc. They also supply the mucosal components of a pharyngeal arc. So in this other image, to your left column, we see the arches, basically. We agree that the first four are the ones which are well visible, and the others are not visible. And to your right column, we see a coronal section through the embryonic pharynx, with this inside being the cavity of the pharynx. And so this being the wall of the pharynx, and externally, we can see the grooves, or what we call the clefts. Within each pharyngeal arch here, we have a core of mesenchymal tissue. We also have a cartilage bar. We do have a blood vessel, a nerve, and muscular derivatives of each of the pharyngeal arches. And as we can see, between one arch and another one, on the inside, we have a depression, which we call a pharyngeal pouch. And on the outside, we have a depression, which we call the pharyngeal groove, or the pharyngeal cleft. And as I mentioned to you, the tissue interface between one pharyngeal arch and another one, that particular one, is what we call the pharyngeal membrane. So now I want us to look at the fate of a pharyngeal arc. What happens to the pharyngeal arc as development continues? As you know, you and I don't really have the arches, at least we don't see the gills in us. So what happens? Perhaps I'll give a count of each of the components of the pharyngeal arch. And starting with the cartilage. The cartilage of a pharyngeal arc basically may involute, which means disappear. But some part of this cartilage may remain. The parts of the cartilage that remain will contribute to formation of the different skeletal structures of a pharyngeal arch. And these skeletal structures are largely either cartilage or bone. All in all, whether they have already involuted or they'll persist, their main role is to provide strength to the pharyngeal arch. It forms the skeletal structure of the arch. The muscular components of the pharyngeal arch differentiate into those different muscles of the head and neck region, the muscles of pharyngeal arc origin. I'll be taking you through those musculature shortly. But I believe from your gross anatomy, you most likely remember something already. the muscles of the first arch, the muscle of the second arch, up to the muscle of the sixth arch. So basically, the muscular component of each arch differentiate into the different muscles of head and neck region, which come from pharyngeal arch. So it's not all the muscles of the head and neck region, not quite. There are some musculature which are not of pharyngeal arch origin, and so we can't include them here in as much as they're still muscles of head and neck region. For example, muscles which move the eye, they don't come from these ones. Things like sternocleidomastoid, they don't come from these ones. Or the strap muscles, the infrahyoid muscles, they don't come necessarily from here. They have a different embryonic origin. Muscles of the tongue, they don't also come from this particular muscular component of a pharyngeal arch. The nerve of a pharyngeal arch will be responsible for providing sensory and motor innervation to the derivatives of a pharyngeal arch. And so those ones persist basically to supply both sensory and motor signals to the different derivatives of a pharyngeal arch. The aortic arch artery usually will supply the different components of a pharyngeal arch, but these aortic arch arteries, most of them also involute, most of them disappear. A few of them persist, and I'll be telling you shortly what each of the pharyngeal arch artery becomes. So I want to spend some time on this slide. But through this, I want to give you a summary of the derivatives of a pharyngeal arch. And we are going to account for each of the pharyngeal arches. What you need to account for is at least the nerve responsible for supplying the components of that arch. We also need to account for the musculature that come from that particular arch. And we need to account for the skeletal derivatives of each particular arch. And as I told you, we also need to account for the aortic arch artery of each particular pharyngeal arch. So let's start with the first pharyngeal arch. The first pharyngeal arch is also known as the mandibular arch. That's the other name of the first pharyngeal arch, the mandibular arch. This particular arch is supplied primarily by the mandibular division of the trigeminal nerve. Now, the mandibular division of the trigeminal nerve offers both motor as well as sensory supply to the derivatives of the first pharyngeal arch. However, we also have the maxillary division of the trigeminal nerve. The maxillary division of the trigeminal nerve only offers sensory supply to the derivatives of the first pharyngeal arch. So take note that motor exclusively come from the mandibular division of the trigeminal nerve. But sensory supply to the derivatives of the first pharyngeal arch come from both maxillary as well as mandibular division of the trigeminal nerve. The musculature which are derived from the first pharyngeal arch are muscles of mastication, primarily. I'm giving you 2 seconds to think through those muscles of mastication, if you do remember them. So there are principally four major muscles, the primary muscles of mastication. We have the masseter, we have the temporalis, and we have the medial and lateral pterygoid muscles. So those four muscles or rather are supplied by derivatives. They are supplied by branches of the mandibular division of the trigeminal nerve. They are derivatives of the first pharyngeal arch. However, apart from those four principal muscles of mastication, and remember, muscles of mastication are muscles which move the mandible, so they help in chewing. Apart from those four muscles of mastication, there are also other musculature which are derived from the first pharyngeal arc, and we can still name them as well. So we have the anterior belly of the digastric muscle. It is also derived from the first pharyngeal arch. We have the tensor veli palatini muscle. As the name suggests, it tenses the palate. So it comes from the first pharyngeal arc. And lastly, we have the tensor tympani muscle. So that one tenses the tympanic membrane. It is also derived from the first pharyngeal arc. So those are the musculatures derived from the first pharyngeal arc, apart from muscles of mastication, anterior belly digastric, tensor tympani, and tensor veli palatini. How about the cartilage of the first pharyngeal arc? The cartilage of the first pharyngeal arc is what we call the Merkel's cartilage. That's the name given to the cartilage of the first pharyngeal arc. This cartilage usually disappears in a large part of it. So the usual fate of the Merkel's cartilage is that it will disappear. However, there are other skeletal structures which will develop within the first pharyngeal arc. So what are these skeletal structures that develop within the first pharyngeal arc? The mandible, that mandibular bone developed within the mesenchyme of the first pharyngeal arc. The maxillary bone also develops within the mesenchyme of the first pharyngeal arc. And within the ear, we have the malleus and the incus also developing from the mesenchyme of the first pharyngeal arc. There are also some ligaments which also develop from the mesenchyme of the first pharyngeal arc, but I'll not go into the ligaments. All right, so that is the story of the first pharyngeal arc. The artery that was supplying the first pharyngeal arc, which we should now call the first aortic arc artery. The first aortic arc artery persists as the maxillary artery. So the maxillary artery is the remnant of the first aortic arc artery. All right, now let's talk about the second pharyngeal arc. The second pharyngeal arc is also known as the hyoid arc. The nerve that supplies the derivative of the second pharyngeal arc is the facial nerve. So the seventh cranial nerve is the nerve of the second pharyngeal arc. The musculature which arise from the second pharyngeal arc are muscles of facial expression. You remember the characteristics of the muscles of facial expression. They arise from bone, perhaps, and attaching to skin. So that means they're subcutaneous. They are located around orifices and so they function as sphincters and dilators. They're all derived from the second pharyngeal arc. They're all innervated by the facial nerve. I'm giving you some few seconds also to just jog your mind about the names of the muscles of facial expression. Think about them. Remember, they are around the mouth, around the nose, around the eyes. I believe a few thoughts come to mind. So like the ones around the eye, you have the orbicularis oculi with the various parts of it. Around the mouth, we have the orbicularis oris. Remember that those ones that depress the mouth. There are those that elevate the angle of the mouth. There are those that you use for laughing, zygomaticus major, zygomaticus minor. You have the buccinator. All these are muscles of facial expression. They're derived from the second pharyngeal arc. Things like frontalis, remember, and the counterpart of frontalis is occipitalis. They're all from the second pharyngeal arc. However, apart from those muscles, which we will classically qualify as muscles of the second pharyngeal, as muscles of facial expression, there are also other muscles which are also from the second pharyngeal arc, although you might struggle to call them muscles of facial expression, perhaps because of their anatomical location. For example, the muscles that move the ear. So, you know, those ones like auricularis superior, auricularis posterior, and auricularis anterior, the muscles which move the ear. That may not necessarily be face for you, but they're still muscles that are derived from the second pharyngeal arc. Well, there are some human beings who can move their ear up and down and anteriorly and posteriorly. Most people can't, but there are few who can. But a better example is to think through a rabbit or something, how they can flap their ears. Then you also have the muscle that we call stylohyoid muscle. So that one also comes from the second pharyngeal arc, the stylohyoid muscle, as well as the platysma muscle. Well, maybe platysma might qualify as muscle of facial expression, fine. Or if you think that could not be, then fine, still include it as muscle of the second pharyngeal arc. What do we call the cartilage of the second arc? The cartilage of the second arc is called the Richard's cartilage. That's the spelling of Richard's cartilage. Richard's cartilage also involute on a large part of it. But we have now the skeletal structures which are derived from the mesenchyme of the second pharyngeal arc. So the skeletal structures derived from the mesenchyme of the second pharyngeal arc include the lesser horn of the hide bone, as well as the upper part of the body of the hide bone. So lesser horn of the hide bone and the upper part of the body of the hide bone, those ones come from the mesenchyme of the second pharyngeal arc. The styloid process also is derived from the mesenchyme of the second pharyngeal arc. And there are some skeletal structures, ligaments or other, that are attached to the styloid, which could also be coming from the second pharyngeal arc, but we agreed we are not talking about the ligaments. Then we have the bone steps. Steps is one of the ear ossicles. steps come from the second pharyngeal arc, yet malleus and incus are from the first pharyngeal arc. Now, the artery that was supplying this particular arch, which now we want to call the second aortic arc artery. The second aortic arc artery disappears for a large part of it. And then some small segments remain, persist in you and me. And these small segments contribute now to what we now have as the ascending pharyngeal artery, as well as the stapedial artery. So the ascending pharyngeal artery is a remnant of the second arch artery. Also, the stapedial artery is a remnant of the second pharyngeal arc artery. The point here is that the stapedial artery represents the dorsal portion of the artery, while the ascending pharyngeal artery represents the ventral portion of the artery. Let's talk about the third arch. The third arch is known as the carotid arc. The nerve that supplies the third pharyngeal arc is the glossopharyngeal nerve, the ninth cranial nerve. There's only one muscle that is derived from the third pharyngeal arch. And that muscle is known as the stylopharyngeus muscle. It is one of the muscles that elevate the pharynx. The skeletal derivatives of the third pharyngeal arch is principally the lower parts of the hide bone. So the lower part of the body of the hide bone, as well as the greater horns of the hide bone, those are derived from the mesenchyme of the third pharyngeal arch. The third pharyngeal arc artery, what does it become? The third pharyngeal arc artery becomes what we now have as the common carotid arteries and the initial segments of the internal carotid arteries. So keep it simple. The common carotids and the internal carotid arteries are the remnants of the third pharyngeal arc artery. Lastly, I want us to talk about the fourth as well as the sixth pharyngeal arches together. The reason being that they share some of the regions that they supply, and even the nerve could be shared. So let's talk about them together. In principle, the nerve of the fourth pharyngeal arc is the cranial accessory nerve. And the nerve of the sixth pharyngeal arc is the recurrent laryngeal nerve. So that is in principle. The nerve of the fourth arch is the cranial accessory nerve, and the nerve of the sixth pharyngeal arch is the recurrent laryngeal nerve. But remember, the cranial accessory nerve, we don't see it much when the nerve comes out extracranially because it joins vagus nerve. And remember that the recurrent laryngeal nerve is also a branch of vagus nerve. So most books of embryology will just tell you that the nerve of the fourth arch and the nerve of the sixth arch is vagus nerve, and that should still be understandable. So if we trace the musculature of the pharynx, the musculature of the pharynx are largely derived from the mesenchyme of the fourth pharyngeal arc. Basically, all musculature of the pharynx are derived from the mesenchyme of the fourth pharyngeal arc, except the stylopharyngeus muscle. So remember, pharyngeal muscles, we have those longitudinal muscles like stylopharyngeus, Now, that one is an exception, but the others are palatopharyngeus from the fourth arch, and salpingopharyngeus, which is also called tubopharyngeus. It's also from the fourth pharyngeal arch. Those are the longitudinal muscles. Then you have the circular muscles, what we call the constrictor muscles, superior constrictor, middle constrictor, and inferior pharyngeal constrictor. So those ones are from the fourth arch. The inferior pharyngeal constrictor usually has two parts. The upper part of it is the one that is from the fourth pharyngeal arch, the part that we call the name is disappearing. Thyropharyngeus is the name I'm looking for. So thyropharyngeus is the upper part, which come from the fourth arch, which means arises from the thyroid cartilage to the pharynx. The lower part of the inferior constrictor, which come from the cricoid cartilage to the pharynx, is called cricopharyngeus. That one would most likely arise from the mesenchyme of the sixth pharyngeal arch. Now, I've already alluded to the concept of innervation of the fourth and the sixth arch. The musculature, which come from the sixth pharyngeal arch, are largely the muscles of the larynx. And in specific, we are talking about the intrinsic laryngeal musculature. So this intrinsic laryngeal musculature, they are the muscles of the larynx that either control the tension of the vocal cord, they control the opening of the glottis, and they control the entry into the larynx, the laryngeal inlet. Those are the intrinsic musculature of the larynx. They're all innervated by the recurrent laryngeal nerve, except the cricothyroid muscle, which is innervated by the external laryngeal nerve. But again, in principle, the external laryngeal nerve is still a branch of the vagus nerve. So when we say that vagus nerve is a nerve of the sixth arch, it makes sense. If we say vagus nerve supplies the fourth pharyngeal arch, again, it should make sense to you based on what I've already told you. The skeletal structures of the fourth and sixth pharyngeal arches are largely incorporated in the cartilages of the larynx. And remember, there are several laryngeal cartilages: thyroid cartilage, cricoid cartilage, arytenoid cartilage, and the like. So this table summarizes for you the different derivatives of the pharyngeal arches. Let me say something about the artery of the fourth arch and the artery of the sixth arch. The artery of the fourth pharyngeal arch, which we call the fourth arch artery, it will depend on which side of the body it is. The right fourth arch artery is the one that becomes the right subclavian artery. So you remember from gross anatomy how the right subclavian artery runs. That right subclavian artery is the artery of the right fourth pharyngeal arch. It's just a remnant. Then the left fourth pharyngeal arch artery is the one that becomes the arc of the aorta. And so again, in principle, we see that the fourth arch arteries are the ones which actually push down the recurrent laryngeal nerve, so that on the left side, the recurrent laryngeal nerve recurs under the arc of the aorta. And on the right side, it recurs under the right subclavian artery. How about the sixth arch artery? The right sixth arch artery becomes the right pulmonary artery, while the left sixth arch artery become the left pulmonary artery, as well as the ductus arteriosus. You guys don't know yet what ductus arteriosus is, but when you look at development of the cardiovascular system, it will make more sense. The ductus arteriosus is an embryonic structure that connects the pulmonary trunk to the aorta in a way to shunt blood so that blood from the heart does not go to the fetal lungs. As you know, the fetal lung cannot participate in gas exchange. Right, so I've made a summary for you on the derivatives of the different pharyngeal arches. And so what you look at here are just images of the different structures that come from the pharyngeal arches. On your left, perhaps showing you the skeletal derivatives of the different arches. And on your right, showing you the muscular derivatives of each of the arches. So if you start on this left side, you can see the one that corresponds to the first pharyngeal arch there. The one corresponds to the second pharyngeal arch there. The one corresponds to the third arch, and the one corresponds to the fourth and sixth arch there. Well, the muscles migrate a lot, and so I think we'll just go with what I've already told you about the muscular derivatives of each arch. Do we have some malformations that are associated with pharyngeal arches? And the answer is yes. There could be many, but I want to highlight just two because they are common. There's what we call the first pharyngeal arch syndromes. So first pharyngeal arch syndromes arise due to some level of deficiency of mesenchyme in the first pharyngeal arch. So mesenchymal deficiency within the first pharyngeal arch may lead to some syndromes of the first arch. There are syndromes because there are multiple clinical manifestations that we see. They manifest with abnormal skeletal makeup of the mandible and the face, so that you'll have some abnormal skeletal makeup in terms of their proportions. So the best described syndromes are what we call Teacher-Collins syndrome and Perry-Robins syndrome. Most of them present with what you see in that particular image. We can see that the mandible is so tiny here. We can see that the ear is a bit small and perhaps relatively lower than what we'd have expected. At your level, I don't really want you to distinguish what is this Perry-Robins syndrome and what is this Teacher-Collins syndrome, because there's significant overlap between the two. Perhaps we can just understand it that they were described by different people at different timings. And so what they could have emphasized on as the key manifestation could just be different, but they have significant overlap between them. Apart from first arch syndromes, we also have what we call golden hair syndrome. Golden hair syndrome presents with facial asymmetry. The face of an individual is not symmetrical. The right and the left face are not symmetrical. And the asymmetry is largely because one side of the face is bigger than normal. Like in this lady here, the right face seems to be bigger than the left face. So they have facial asymmetry. Now, Goldenhar syndrome affects both the first as well as the second pharyngeal arc derivatives. Those are the ones I want to talk about. And so as we finish, let's now talk about the the other components of the pharyngeal apparatus. These ones will now be quick. I started by telling you that each pharyngeal arch is separated by a pharyngeal cleft and a pharyngeal pouch. I also told you that the pharyngeal clefts are the grooves which are external, and so they are lined by ectoderm. And I told you that the pharyngeal pouches are the grooves which are inside, the depressions which are inside, and so they are lined by endoderm. I want us to talk about the fate of the pharyngeal clefts. The first pharyngeal cleft, which means a cleft that separates the first arc and the second arc. The first pharyngeal cleft contributes to formation of the external auditory meatus, basically the outer ear. So the channel there contributes to formation of the meatus, while the edges of the channel are the ones that will contribute to formation of the pinna of the ear. So I want you to understand that the first pharyngeal cleft basically forms the outer ear, either the meatus, what we call the auditory canal, or the pinna. The pinna will arise from the edges of the meatus. The other pharyngeal clefts, and I want you again to understand that now that we have only a total of 5, albeit the naming system, we will then expect to have only 4 clefts. The first cleft forms something. The second to the fourth cleft usually fuse and obliterate. They don't become anything. They fuse and they obliterate. Now, failure of obliteration of the second to the fourth cleft then can give us some malformations in the head and neck region. If the second to the fourth pharyngeal clefts persist, we will have some malformations that we can call cervical cyst, cervical sinus, or a cervical fistula, depending on the morphology. A cyst is an enclosed space without any drainage. A sinus is a tract with a blind end. So that means that that sinus could be opening on the skin, like here. It could be opening the skin, but has a blind end. That becomes a sinus. A fistula is an abnormal channel that connects two epithelial surfaces. In this case, it will be connecting the skin on the external and the mucosa of the pharynx on the internal side. So persistence of the cleft can give you any of those 3 entities. Like the one we are seeing in this image, we can see it draining, and perhaps it's closed on the inside, so most likely a cervical sinus. Of course, now this one cannot be a cyst because a cyst can't drain. But if it is opening into the pharynx as well, then we'll call it a fistula. Of importance that all of these malformations occur anterior to the sternocleidomastoid muscle. They are all anterior to the sternocleidomastoid muscle. That's the story about the pharyngeal clefts. Now let's talk about the fate of the pharyngeal pouches. Again, remember that there are 5 arches, albeit the naming, and so we'll expect to have 4 pouches. First pouch, second pouch, third pouch, and fourth pouch. The fourth pouch is worth mentioning. When the fifth pharyngeal cleft involuted, when the fifth pharyngeal arc involuted, what was supposed to be the fifth pharyngeal pouch then merged with the fourth pharyngeal pouch. And what was supposed to be the fifth pharyngeal pouch is what we call the ultimobranchial body. So the ultimobranchial body is basically the tissue remnant in the bed of the embryonic fifth pharyngeal pouch, but now has been incorporated into the fourth pharyngeal pouch. You can call it ultimobranchial body or ultimopharyngeal body. Now let's talk about the derivatives of each of the pharyngeal pouches. So the first pharyngeal pouch, that is the pouch between the first arc and the second arc. The first pharyngeal pouch grows towards the first pharyngeal cleft. It contributes to formation of the auditory tube, which means the eustachian tube. It also contributes to formation of the middle ear, which means the tympanic cavity. And I will add one that is not in this particular slide. It also contributes to formation of the mastoid antrum. So three derivatives of the first pharyngeal pouch: the auditory tube, the tympanic cavity, and the mastoid antrum. While we are there, because we are not going to talk about this again, look at this image and think through. So what will the first pharyngeal membrane become? This is the only membrane we'll talk about, and so I don't have another slide for it. So let's finish with it here. Because we've agreed that the other clefts involute, that means that we'll not talk much about the membranes. But the first cleft formed something, the outer ear, as we can see in that image, and the edges of the cleft form the earlobe, the pin of the ear or the auricle. The first pouch forms the auditory tube, middle ear, and mastoid antrum. So the first pharyngeal membrane, the tissue interface between them, what do they become? The first pharyngeal membrane will become the tympanic membrane. It becomes the eardrum. And remember that eardrum will be having three tissue layers: outside ectoderm, inside endoderm, in between mesoderm, even though it's very thin, as we can see in this image. All right, so that summarizes the story of the first pharyngeal pouch as well as the first pharyngeal membrane. We will not expect to talk about any of the other pharyngeal membranes. The second pharyngeal pouch, what does it become? The second pharyngeal pouch becomes the bed of the palatine tonsils. It forms the bed of the palatine tonsils. So remember, the palatine tonsils are between the palatoglossal arc and the palatopharyngeal arc, if you remember that anatomy of the oral pharynx. The third pharyngeal pouch, what does it become? The third pharyngeal pouch gives rise to the tissues that form the thymus. But it also gives rise to the tissues that form parathyroid glands. Now, because the thymus migrates so much into the thorax, even though it's coming from the neck region, it must descend into the thorax. Because of that longer trajectory of migration, it pulls with it the parathyroid glands, which are also arising from the third pouch. And because it pulls with it the parathyroid glands, therefore, the parathyroid glands that will come from the third pouch will be the ones which are inferior, as opposed to be the ones which are superior. So even though this is the third pouch, and we are going to see that the fourth pouch gives you the superior parathyroid glands, even though this is the third pouch, the parathyroid glands which come from it have a longer migratory path. And so they're the ones which will go much down. The inferior parathyroid glands are the ones which will come from the third pharyngeal pouch. Then the superior parathyroid glands are the ones which are going to arise from the fourth pharyngeal pouch. But remember, the fourth pharyngeal pouch was also being formed partly by what we call the ultimobranchial body. The tissues of the ultimobranchial body contribute to the formation of the parafollicular cells of the thyroid gland. The parafollicular cells of the thyroid gland are the calcitonin secreting cells of the thyroid gland. Okay, so basically, these are the derivatives of the pharyngeal pouches. And so that will summarize the end of that lecture that we are to have today on the pharyngeal apparatus. So the next section on the development of head and neck series should focus on development of the endocrine glands of the head and neck region, in particular focusing on thyroid, parathyroid, and pituitary glands. Thank you very much for your attention.